And welcome to the Dr. Bob Show. We'll be spending most of this show talking about diabetes. 34 million people in the United States have diabetes. Sometimes it's so mild that people don't recognize the symptoms and don't detect it early. In that case, it can go on and lead to blindness, to heart attacks, to strokes, to chronic kidney failure, to neuropathy, to amputation. It's a devastating illness, but if caught early, there are things that we can do. We're going to be learning that on the Dr. Bob Show on this show. My guest is Dr. Amit Vora. Dr. Vora is a board-certified endocrinologist, and he has a special passion for type 2 diabetes and getting people on the right pathway to excellent health. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about exercise, eating right, laughter, and those other things that make us healthy. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Amit Vora, and we're talking about diabetes, type 2 diabetes, what causes it, what we can do about it. Dr. Vora, thank you for coming to the Dr. Bob Show.
Absolute honor and pleasure, sir.
Tell me about diabetes. What is diabetes?
Diabetes is very common. Diabetes is a disease of high blood sugars. Whenever we consume a carbohydrate, it's designed to get into the cells to nourish our body. If that doesn't happen, it hangs outside, causes high blood sugars, and doesn't nourish. When it stays outside, it has the potential of causing complications. The blood vessels don't like the high blood sugars, hence the complications, the retinopathy, kidney problems, nephropathy, heart problems. So that's, in a sense, the big picture of hyperglycemia or diabetes.
So is there a way to tell if somebody is on the pathway to getting diabetes? Is there something that starts early? How do you make the diagnosis? How do you help the patient?
Lots of wonderful questions. There's a whole bunch of people that have type 2 diabetes, and just to give you a quick statistic, that's about 30 to 35 million Americans.
Wow, that's a big number.
Big number.
And if you don't take care of it, it leads to heart disease, kidney disease, eye disease. So how do you detect it?
Detection. There are a couple of different definitions. The old-fashioned is the blood sugars. Anything over 126, fasting, is diabetes. I'm a believer of just doing a hemoglobin A1C.
Now, why is A1C better than fasting blood sugars?
Because I want this opportunity of being diagnosed to not be missed. So if I go to my doctor's office at 2 o'clock in the afternoon and I'm not fasting, I still want that person or me to be diagnosed. So if they just did a reasonably inexpensive blood test called the hemoglobin A1C, that's a 3-month report card on their glucose excursions.
So it gives you a guideline of what's happened to the blood sugar over a 3-month period of time. So you can't cheat 2 days before and not eat, or you can't change your way of life just right before you see the doctor. You better do it for 3 months.
That's a very common, you're so right. I have to eat smart because I'm going to my doctor's office. Now the A1C is immune to that. It captures the excursions for the last 3 months. And so they don't have to be fasting, and it spits out a number, and that number in a hemoglobin A1C of 5.8 to 6.4 is pre-diabetes. They're
So
knocking
that's
on the door.
pre-diabetes. That means it's a little higher than you want it to be, but it hasn't hit the mark yet.
That's correct. And then a 6.5 and above is the real McCoy. And that's where I'd love to pour all our preventive care passion in identifying, you asked this a minute ago, what is very interesting a statistic. It's actually depressing. There's about 90 million people in the United States that have prediabetes. That's, in my opinion, the mission statement or the stuff that not a lot of people talk about. But if we were to get savvy and help identify those people, 8 or 9 out of 10 that have prediabetes don't even know.
So if they don't know and you find out by hemoglobin A1C and they've got prediabetes, what do you tell that patient to do? And who are you thinking has a good chance of having prediabetes? Is it due to being overweight, or who's at risk?
So the answer to the first question is, if we were to identify these at-risk people, we can turn the tide. And everybody likes to hear, can I avoid or get rid of diabetes? It's very possible. The sermon is not complicated. They could go on medicines. There's evidence to say that metformin or some of the other GLP-1 injections can help with weight loss and help reduce their hemoglobin A1C. But I start off by just saying, let's become aware of carbohydrates. Let's become aware of the nutrition part of this. Fall in love with protein, fall in love with vegetables, cut back on carbohydrates. Take your spouse and go on a walk for 30 to 40 minutes, 3 or 4 days a week. That is going to do.
What a great thing. So you're changing your diet, what you're eating, and you're increasing activity. Is that hard to do? How long do you have to walk? How far do you have to walk? What if it's raining? I can think of all sorts of excuses.
Yes. The guidelines, I think 150 minutes. That's 30 minutes, 5 days a week. That's not difficult. And if in turn that is going to prevent diabetes, I'm not big into asking people to become a saint and give up everything, but just eat smart. Just know what they're enjoying and enjoy the blessing of the food, but don't over-enjoy it.
I always tell people, eat less and exercise more. Look at your plates. The plates used to be a 9-inch plates, and then they got to 11, and then it got to 14 inches. And if you fill that up with food, you're going to ingest a lot of carbohydrates, and that's going to cause trouble. So you watch how much you eat, and you exercise more. Does that help?
That does help. I don't think that people realize the simple changes. Just meeting with a nutritionist or doing a quick search and understanding how they're nourishing can turn the tide. There is a lot of hope. The answer to your second question, Dr. Bob, who is that person who should ask their doctor, can I please get an A1C test? I say this, if they have a family history of diabetes, if they're slightly overweight, if they have a Hispanic or Black ancestry, African American ancestry, they are high risk. But anybody who even thinks that they might have early diabetes, it's an inexpensive test, and no internal medicine or family medicine doctor is going to say no to that. You say, listen, I want to know if I'm flirting with early diabetes. Can I get this test?
And it's something that everybody should have pride of ownership if it's normal and you're not pre-diabetic. And if you are pre-diabetic, it says get to work, open up your eyes and start changing your lifestyle. Now, the things that diabetes can it cause other medical problems?
It can definitely cause both small vessel complications, and big vessel complications.
And that's what we're going to be talking about when we come back. What are some of the complications that if you have an elevated hemoglobin A1C that just says pre-diabetes, what can it be doing in the background to harm your health? We're talking with Dr. Amit Vora, board-certified endocrinologist. We're talking about diabetes. We walked toward pre-diabetes or type 2 diabetes, the people that are a little bit overweight, maybe African American, higher incidence, people that are inactive. They need to be sure that they ask their doctor for a hemoglobin A1C. And if it fits into a pre-diabetes level, then there's lots of things that we can do. Now, before we go into that, let's talk about what vessel disease does the pre-diabetes cause and what illnesses?
So both diabetes and we think even pre-diabetes, their clock in terms of complications starts early, which is again why the emphasis on trying to detect early and help undo that. The big complications are the heart trouble. Cardiovascular disease, Dr. Bob, 3 out of 4 patients, 3 out of 4 people with type 2 diabetes that you and I see will end up having cardiovascular problems.
That's really significant. That means you're on the road to maybe ending up in the emergency room, heart casts, really changing your lifestyle. So we can start that early, maybe not get the heart disease.
That's correct. And traditionally, we've been a little guilty, I think, of being a little glucose-centric and just working on the blood sugars. And that's important because it reduces the risk of retinopathy or eye disease or nephropathy or kidney disease or neuropathy. But I really think we ought to get to the heart of the matter. And 3 out of 4 people are going to run into that problem. Our mission statement has to include protecting the heart.
So how can we do that? We're going to change our lifestyle, watch what we eat, get a little bit more active, take our mate out for a walk, 150 minutes a week. Now, what about medications? What do we do medication-wise?
What is so beautiful and exciting in the business of helping our patients with diabetes is an explosion of new molecules or new medicines that, in addition to what we knew about our statins and our blood pressure reduction, that we know reduces the risk of heart attacks and strokes. There's metformin, which has been around for the longest time, which is dirt cheap.
What does it basically do, the metformin?
Yeah, I don't think anybody knows.
Knows completely.
But it does help bring the A1C down. It tells my liver not to make a whole bunch of glucose. And like I said, it's been around for the longest time. It's dirt cheap. Then on the next step after metformin is where I think there is a lot of excitement. So I'm a big advocate of using either a GLP-1.
GLP-1.
That's the glucagon-like protein, and those are injections that are once a week. Now, the moment we say injections, there's a lot of people who are thinking, that's not easy.
Yeah, but once a week is a lot better than once a day.
Once a week, small needle, do it at home, protects the heart, reduces the hemoglobin A1C, and helps with weight loss.
Yeah, so some of those I've been listening to the commercials on television. They basically say, and I lost 12 pounds. You know, and everybody would like to lose 8 to 10 pounds of weight, almost everybody. So you've got weight loss, you've got better control of your blood sugar, and it's cardioprotective. So it protects the heart.
That's correct. And with that same second step, some people might choose another class of molecules called SGLT2 inhibitors.
SGLT2. We're going to be using our typewriters on all these.
These are sodium glucose cotransporters. They go by some brand names called Invokana, Jardiance, or Farxiga.
Are these good?
these are also equally good. And this is why I'm so excited, because you know what? Cardiologists, nephrologists are all getting on board. I've seen notes from a cardiologist saying, hey, your patient has type 2 diabetes and they've had a heart problem, CHF or a heart attack. Dr. Joe, how about you consider putting them on this class of medicines? Because again, with the SGLT2 inhibitors, Dr. Bob, similar benefits. There's heart protection, the A1C goes down, and there's some weight loss. Maybe not as much as the GLP-1s, but I believe in that trifecta: metformin, GLP-1, and the SGLT2.
Along with exercise and eating properly.
You're absolutely right, sir.
I think socialization, being a happy person, also helps protect a person's health. And I think we're doing a good job in the United States of learning all these things are so important in staying healthy. And when we look at the blood sugar and when we look at prediabetes, we now know we have a real strong pathway toward better health, toward protecting the heart. Now, we protect the heart, but when we protect the heart, we protect the kidney also, and we protect the blood vessels that are in the eyes also. So
that's correct.
You know, it's a winner all the way. Do most primary care physicians or just endocrinologists know about the newer medicines?
I think almost all family doctors and internal medicine doctors are very, very comfortable. I'd like for them to even be more comfortable.
Sure.
There's maybe a hint of reluctance when it comes to an injection, and I hope and pray that both healthcare providers and our patients kind of get over it, because the benefits are pretty big.
Yeah, and you mentioned that the needle size is very small and really small in its diameter. So it really, all needles hurt, but it really doesn't hurt.
That's good.
When it's doing such good. You have to do it once a week only.
Once a week.
And so how often do you get your hemoglobin A1C checked to see how you're doing?
Very great. Well, our red blood cells have a lifespan of about 3 months. Mm-hmm. Once they have a love affair with glucose, it takes 3 months before you can undo it. So the recommendation is to check it again about every 3 to 6 months, depending on how high the A1C is. Not sooner, because that old blood has to wash out.
So the doctor can get the values and see if the patient is improving or not, and can decide what he needs to do to say, are you cheating a little bit? Are you eating too much? Or you're not exercising at all? So there's some things that it's really a contract between the doctor and the patient of guiding them toward good health. What age group should we start trying to detect?
That's a tough question. I think that depending on their risk factors, if they're overweight, if we talked about some minorities that have a higher risk, somewhere around 40 to 50, I would say, start thinking about getting an A1C. It's inexpensive and most people will gladly do it.
Is there a way to monitor our blood sugar?
There are very nice, very exciting and happy ways to monitor blood sugars.
That's what we're going. Happy ways of monitoring our blood sugar. You're going to be shocked and surprised, and gleefully so, when you find out what's available for knowing what your blood sugar is. Stay tuned. We're talking with Dr. Amit Vora, and we're talking about diabetes, and we're talking about hemoglobin A1C, and we're talking about what we can do to get our diabetes under control or better control with medications and with changing lifestyle. What we eat, how much we eat, and how much activity we have. I want to talk a little bit about why the blood sugar goes high and its interaction with insulin. So talk to me a little bit about insulin and where it stands in the treatment of diabetes.
Like I said a few minutes ago, insulin is produced the moment we eat, but In a lot of people who might be slightly overweight or have a family history of diabetes, there is a condition called insulin resistance, just inefficiency in the utilization of insulin. So there's not an absolute lack of insulin, it's just that it's not working well.
So where is the insulin made?
The pancreas.
So the pancreas, and there's a certain part of the pancreas that puts out the insulin. Sometimes it puts out bad insulin, or the body says, hey, I'm not going to let you work good.
It's more of the latter. The beta cells make insulin, but sometimes it just doesn't work well enough. And this is why your recommendation or sermon a few minutes ago about eating smart, losing weight, might be the best way to break that resistance and bring about efficiency in utilization of insulin.
And that's great incentive for the patient. You have some new devices that help us monitor what our blood sugar is. For instance, what is your blood sugar right now?
Well, my smart device will, if I just said it, it would read my blood sugar, which right now is
82.
82.
So it's measuring it. How does it know what to look at?
Because it's a psychic. No, just kidding. I'm going to show some skin here.
So you have a little place on your stomach
Yes.
that does the reading and sends the message to your phone, and you can read it.
That's correct.
So that would mean, well, wonder what this big meal that I've overeaten has done to my blood sugar, and what's it going to be like 2 hours from then. So it gives a lot of advice to the patient that they can talk to their doctor about. Anything else new in the monitoring or sending a message to the doctor if things are going out of whack?
You know what? If anybody were to wear any of these glucose sensors, I could be sitting in my office, or any family doctor, or my dad could be wearing it in a different country, and I can look at his or her blood sugar and say, John, you had a big meal. It's almost every day in the evening that your blood sugars are high. And mind you, this is not a painful prick on the fingers, which hurts. This goes in and it's good for 7 days or 14 days, depending on which flavor of sensor they wear. And the healthcare provider can give that person guidance on what is happening.
I think that's so cool. It's like Big Brother, your doctor is watching over you at all times for that. And that's important. It lets the patient know that somebody's interested in his blood sugar and interested in his health and is trying to protect his heart and his kidneys and his feet and neuropathy and Alzheimer's. That's fascinating. So how long have we had these devices?
At least 2, 3, 4 years, but what I'm hoping and praying will happen is as they become less and less expensive, that every single person that has type 2 diabetes has a sensor to guide them. Like you said, people may or may not like to hear from somebody else. Even a well-meaning spouse says, John, you don't eat that lasagna. But if they see the sensor go high, they know. Instead of having 1 or 2 points in time when they know their blood sugars, this is a continuous database that's empowering and engaging and giving our patients the driver's seat. They need it.
You know, and I think this information is just across the street. We're getting more and more availability on treating our patients properly with these devices. Amit Vora, you're a great teacher. It has been so much fun for me to learn from you the things that we can do, the new medicines that are there. I appreciate your coming to the Dr. Bob Show.
Honor and pleasure, sir. Thank you.
It's mine. Remember those things that we talk about on every show, how important exercise is. And it's very important with diabetes because it helps drive the sugar into the muscles. So be sure you're getting your exercise and doing it every day. 5 days a week, 6 days a week, 7 days a week, 30 minutes, and you'll have a lot of fun doing it. Find a mate or somebody who's a friend and do the exercise together. Be sure that you're eating properly. Less fried, fatty foods, more fruits and vegetables, smaller amounts. get the bad habits of eating out of your life. Use the monitoring devices to know what's going on in your life. And be sure that you're getting 7.5 hours sleep. People that get 7 hours of sleep, their immune system works better. They're happier. The people around them will be happier. The world will be happy, all because we've gotten adequate sleep. If you're not sleeping properly, then be sure and talk with your doctor and find out if it's pain that's keeping you awake, that other medicines are keeping you awake. There's so many things that make us sleep poorly. So be sure that you're getting your 7.5 hours sleep. And most of all, what is it we like in the Dr. Bob Show? Above all things, it's that laughter in your life. Spend a little bit of time thinking about yourself, thinking about the things you enjoy. Sometimes I like to read the comic papers, the Family Circle, the things that make me laugh, or look at caricatures, look at drawings, talk about what's happened at work today. Those things will make you laugh, make you giggle. Your immune system actually works better. People have less upper respiratory infections when they're happy and when they're laughing and smiling. So smile a lot, laugh a lot, and you'll be healthier.